So I think monotherapy is the way to go for now, at least with this device. We do have the other SunRISe trials, which we don't have time to get into, but there's some other sort of exciting news with the other trials coming through. Now, this cohort 4 opened quite a while after the trial had been opened. Cohort 4 was patients with papillary disease only. And you had to, so basically it became more of an adjuvant study, right? The cohort 2 had to have CIS, and about a third of the patients, if I remember correctly, had papillary disease along with CIS.
Mhm.
Cohort 4 was papillary disease only, right? And we're beginning to see some good results there as well. So now it's an adjuvant. You get rid of the papillary disease and use it. Do you have any patients on cohort 4?
I don't, but I did see some of the results that was presented at the AUA, and although the numbers are not huge, it does look like it's like a pretty impressive signal so far. Do you have patients with
So I have
papillary
patients
disease?
on SunRISe-5, which is essentially
Yeah.
exactly that cohort, right? So
Hmm.
SunRISe-5 is papillary disease only, no CIS. Trying to fill that gap of, do you have to have CIS for this thing to work? And of course, I actually saw one of the patients yesterday for follow-up, and he's doing terrific so far. So I suspect we're going to see similar results in papillary disease as we did with CIS only. So the exciting news is, okay, now this has been published. It's probably going to make its way into the guidelines, and so we're getting close. This is FDA fast track approval, and I think hopefully pretty soon. We have all the data's out there, all the safety data's also out there. So we're going to start to see commercial use of TAR-200 fairly soon. Are you set up, and who are you going to use this in?
I think this is going to be fun. I think this is going to be really fun because there are no comparison trials, right? So
Right.
we have to decide as a community because I think we're going to have a lot of options. We already have a few options
Yeah.
that are available, and we're going to have to sort of think about, who's going to benefit from which drug. I I'm set up and I'm ready to go. For me, this is competitive. It's about as good as results as we've seen. If you look at the data, it's for me, it's probably the easiest one to give in the clinic. Definitely with the safety profile. Um, Patients, I do have, I live in, I live in central New York, so patients are coming, from, sometimes 2, 3, 4 hours away. So when I tell them every 3 weeks, they're like, okay, whatever it takes. Like even if it's 3 weeks, I'll come see you every 3 weeks. But selling them, every week. So I could see this really becoming a huge part of my practice, and I think all of us are excited to incorporate this. Interested to see how you respond to the same question.
Yeah, likewise. I think, yeah, don't worry. I'm not going to ask you the tough question or which one are you going to use next. But you're right. It's just one more addition to our, like I said earlier, the armamentarium of the new therapies we have, and there's some other new therapies coming along the way that are sort of late stage in their development and fast track approval as well. I think you're right. We're set up. We did the trial, right? So. I'm actually excited to once we get the guardrails. I mean, this has to be removed exactly on this date, and once those are removed, we can go back to being clinicians and saying, okay, it's fine if you show up next week to get this removed, or so on and so forth. There are only 2 weeks. One thing that we didn't talk about is the schedule for those who may not know that it's placed in the bladder and then removed 3 weeks later where a new device is placed. And this goes on for 6 months. So every 3 weeks for 24 weeks. But the after that, it's quarterly. It's once every 3 months for a period of 2 years. Now that schedule was sort of made up essentially based on extrapolation from other studies and stuff. But as you said, I'm excited to be able to use this in patients who didn't meet the strict criteria for the trial, because I do think many patients would benefit from it. If he had a history of other malignancies, or some of those exclusion criteria that are important for trials, once it's approved, I think we can offer it to a lot more patients. So it is exciting. I hope it comes to our clinic very soon, and I think it'll be a very successful launch as it's easy to implement into the practice.